Welcome to the Banega Swasth India podcast. Our focus this season is One Health, One Planet, One Future. Our aim is health for all and leaving no one behind, because only a Swasth Bharat can be a Sampann Bharat. I'm Ambika Singh Kama. As the world marks last week of April as World Immunization Week with the theme Long Life for All, with the focus on spreading the message that immunization is one of the world's most successful and cost-effective health interventions, and it helps save millions of lives every year. Team Banega Swasth India speaks with Dr Vivek Virendra Singh, Health Specialist Officer in Charge, Chief of Health, UNICEF. He talks about India's immunization program, COVID-19 vaccines, India's role in developing COVID-19 vaccine, booster shots, and more.
The first thing is to say, I would like to ask you, we're celebrating Immunization Week. What role has immunization played so far in saving lives?
Ambika, the world celebrates this World Immunization Week every year in the last week of April to galvanize support for this, one of the most cost-effective global health intervention, which has added life to the ears of populations at large. Think of it globally. Modern medicine has been able to add some life to the individuals, but at the population level, it's just two simple public health interventions, which is improvement in water and sanitation and immunization, which has been with us for 2 centuries now, which has added life to the years at the population level. So that's the importance of immunization. And we use this week to galvanize all the stakeholders for this public health intervention.
Absolutely. Like you rightly said, it's a very, very critical week. And yes, immunization has played a very important role. How would you rate India's COVID vaccination drive?
See, if you think of India's COVID vaccination drive, the numbers speak for itself. For a population size of a country of India, if you're able to vaccinate most of your people with both doses and at such great speed, I think as a country, we fared fairly well. 2 points which come clearly from this campaign was, one was the ownership and coming together of whole of society with the leadership, right from the highest level of polity at the union level in the different states. Health is a state subject, we know. But we saw that leadership right from, the polity to bureaucracy to the frontliners to volunteers. And we saw that, how volunteers, for example, were coming up with apps. You talked of misinformation where people can get information. But one important point also we should all remember is how India worked on production of these vaccines. So speed with safety also, because it takes a lot of due diligence to come up with a vaccine. And India did come up with indigenous vaccines, but with a lot of safety, ensuring a lot of safety as well. So these were two important highlights for the immunization campaign for COVID.
Okay. Moving on to booster doses, Dr. Singh, India has just rolled out boosters and, everybody, all ages are eligible, the adults. While other countries have done it earlier, in fact, some of them are also going to be taking the 4th dose. Is the timing right for India's booster dose announcement?
I think yes. And India has a very robust system of taking scientific evidence into all its policies. And especially for the COVID, there is a NTTV, National Technical Advisory Group on Immunization, which takes into account all the scientific evidence, and that's how it's being recommended. We do not know how much and as we all know by now, which variant and how much will the immunity last. So I would urge everyone who's eligible for a precautionary dose now to step out and take that dose, because we have seen clearly in the 3rd wave how people were affected less in terms of the severity of disease and all of that. And it was mainly possible because of the 2 doses that most of the population had. So people should be stepping out and taking their booster doses whenever they become available.
Okay, so booster doses, yes, you recommend that. What do we know about the booster doses, Dr. Singh? How long does the immunity last? And frequently will booster doses be required? What is your thought on that?
See, in the current evolution of the microbe, I think this booster dose has been recommended because it does enhance the immunity. The virus, we know that by the time it fades away, the pandemic ends, it keeps evolving. So as of now, the waning immunity does require booster dose, but how long will it last? Will the new variants need it, or will there ever be a need? Or based on our historical evidence, these may be the next few months or years. So I think it's too early to say that how long will the booster be required, but I think boosters will definitely help at the individual's immunity to tackle the existing variants, and they should just step out and take the booster dose.
So I think the bottom line here is one must go get vaccinated, and booster dose is key. Dr. Singh, India is also the hub of vaccine manufacturing. But how do we fare when it comes to vaccine administration? According to you, how successful has India's overall immunization program been?
So think of it that in 1978, when India started in its extended immunization program, giving 3 antigens, 78 to today, in 40 years, 4 decades, now the country is currently administering antigens for 12 diseases. 12 diseases. And these antigens over the years for a population of the size of India, so 2.9 crore mothers and about 2.6 crore cohort of the children who are born, the newborns, they receive these vaccines each year through our immunization program. And from the time of production to its delivery on the front lines, so imagine India conducts about 1.2 crore vaccination sessions with the help of 150,000 healthcare workers, and maintaining the quality of the vaccines right from the production up to the front lines for these numbers. So India has a unique system where it's cold chain, and I don't know if people know of this, that there are these walk-in coolers and freezers where you actually walk into a storage unit at a state level. There are 740 district level walk-in cooler and freezer type storage units for vaccines in the country, and about 100,000, 1 lakh equipments which are temperature controlled equipments in the vaccines are stored, and these are connected through a mobile chip based, the SIM card based data loggers, which give real-time information on the cold chain maintenance of these vaccines till the time they reach the front lines. And this intervention of India is now being taken globally by many UN agencies who are helping other countries to strengthen the vaccination program across the globe. So I think if you take the lessons from a country like India, right from the production to the delivery at the front lines, there are a lot of lessons from the India's program. And, vaccines for this year's theme, that long life for all, we all know that especially for children, vaccines don't just add long life to the years, they also add the life to the years that is enhanced because of vaccines. So children are able to play. Let's say if a child is afflicted with polio, we know what happens to the child. If a child suffers from the vicious cycle of diarrhea, measles, and gets into a cycle of malnutrition, we know how the child will suffer and may not be able to grow with the proper growth trajectory that a child is entitled to as a right. So we know that vaccines also add a lot of life to the years, and children are able to not just survive, but also thrive to their maximum potential.
And absolutely, I think you've explained that really well, Dr. Singh, how important vaccination. And I think India, you've really put it out there that how much as a nation India has done. If we talk about the NFHS 5 data, Dr. Singh, the percentage of children in India taking essential vaccines is definitely improved from 2015, 2016. Going forward, what steps do we really need to take to keep up with this pace of vaccination and ensure that we leave no one behind, which means obviously rural areas, the tribal communities, the last mile connectivity, let me put it that way.
I think that's a very important point moving forward, that as on date, with the increasing number of antigens which are available in the vaccination program and most of the kids getting it, I think now the priority should focus on those not getting it for whatever reasons than all the successes and achievement of those we are able to reach.
Yes.
And for that, there's a global call also in the strategy moving forward to the 2030 goals, which is calling for all stakeholders to converge their energy in reaching the children which are so-called the zero-dose children. Because imagine in today's times, with the kind of health system investments that countries have made, and we have seen that in India as well, it is absolutely not right that some kids still get left out. And they get left out for various reasons, which can be both from the demand side, that is from the communities and families, or it could be from the supply side. But the government is seriously working on not just celebrating the steady progress that has been made, but also in reaching the unreached. India also, keeping in line with this global call, it had already started this mission Indradhanush to reach the unreached. So there were districts specifically marked with low immunization coverage, and this data was not from the surveys, but real-time data from the health and health management information systems. And this has continued from 2014, and now we are in the version 4, the phase 4 of the mission Indradhanush, where the country is again going to target 416 districts, in fact. Began with about 200 and odd, but now it has been extended to 416 districts to try and go and reach the unreached. And this is where we will need support from all stakeholders, that if anybody, be it an institution or an individual, if you feel that there could be communities where the children may not have received all the antigens or may not have initiated the immunization for some reason, we need to go out and see if there are kids that may be left out, and raise awareness that vaccination is something which is available in all public health facilities. In India, in fact, 95% of all inoculations, the immunization happens in public facilities, which is a very important point, that, the quality of the vaccines in India, there is so much confidence in it that even small private sector takes the vaccines from the district immunization office or the state immunization office. So the will is there. There is availability in the system. It's just that all of us need to come together and ensure that no child is left behind.
Absolutely. I think what you said. Dr. Singh, COVID-19 has also taught us the importance of vaccination in controlling the spread of the disease as well as mortality. What are some of the other diseases that need, where vaccines are needed to put an end to it?
See, we know that the world is working on many of the elimination and eradication goals. But yes, as you rightly said, COVID-19 has taught us that wherever the vaccines are available, we must use them. I would rather put it slightly differently. COVID-19 has also taught us that how healthy population groups are important for resilience to such pandemics for future, for the future. And when we say healthy population groups, the vaccines play a very important role for whatever antigens are available. That a population which has good routine immunization coverage, which is given from birth to children, and then of course now there are vaccines for adolescents and adults. So if the population in any country is well vaccinated for the antigens available, obviously they'll be more healthy, and that will add to the resilience in that country. So for whatever it is available, then of course the world is working on many other elimination targets. We know that India was able to achieve the polio eradication in 2020 certification, and then the tetanus elimination targets. But measles is another disease which is marked for elimination, and we are doing fairly well there. That is something we need to take further advantage of. And similarly, the newer vaccines which are now coming. So we have seen that how most of these pandemic potentials are the ones which are influenza-like viruses, the so-called viruses which affect the pulmonary system. So there is the pneumonia vaccine, which is now available and which is also in the immunization program. So these vaccines will have to we will have to increase the uptake of these vaccines for the future.
It's been a pleasure to have you with us. Thank you for sharing all these important tips. And, it's great. And I just really hope like what you've explained and, the importance of immunization is really, really credible. Thank you so much, Dr. Singh, for joining us.
That's it on Banega Swasth India podcast this week. If you have comments, queries, or suggestions on the topic we discussed today or issues you would like us to cover in future, write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter, and Instagram and continue the conversation through the week. Till next week, this is Ambika Singh Kama signing off. Stay healthy, stay safe.